Hello everyone, it's Sleeved After 60, also known as Monica, and it's Wednesday, March 1st, excuse me, 2017. The countdown is on 13 days to my VSG. So I'm coming to you first thing in the morning, having coffee in my pajamas with my sweet dog. I don't think my dog has ever been seen. This is Ralphie. Ralphie, yeah, Ralphie is one of those dogs that I think I might have a picture in my Instagram, but yeah, he just wants to be part of. So I woke up this morning really early. I was able to, I think I watched a couple of videos and kind of woke up sort of having a a lot of anxiety. I'm convinced that there's going to be something in my blood work that they're going to tell me they can't do the surgery. And then I just finished filming my my pre-op video to myself. And so there's a lot going on here this week. I think I may have just mentioned that we had some a sprinkling of snow. Oh, excuse me, coffee. I'm just anxious and jittery, and usually I'm a lot more, making sure one of my closets, doors closed, and all that, and that at least I have some lipstick on. And today, I'm not sorry or complaining, or I'm just stating the facts. I'm really anxious. I'm anxious that this is not going to happen, and I don't know why, but I'm just am. Stats. I've been on this weight loss medication that since December 28th, I think is when I started. And it's very expensive medication. It's about $220 a month. So I've been on it. This is my second month. I don't remember what weight I was in when I started it, but I'm down to 203. I'm a really slow loser, and I am under 5'5", and I will be 64 in May. I was hoping that I'd be in Wonderland when I have surgery. I don't know if it's going to happen. I just don't know. There's no pre-diet. I think I'm only on liquids for a couple of days. I have to start on Sunday, so 2 days before. And one of the things is that I decided that I'm not going to get too overly concerned with that. I haven't done any food funerals or anything like that. As I was making the whatchamacallit, so I was making the goal video. I was just saying that I haven't had any issues with binging in a long time, so that seems to be okay. Things are okay, I mean, my life is just kind of moving along. There are other issues going on, obviously. Life is just life. But eating disorder-wise, I seem to be, at a good place. And the medication has not, I was supposed to lose 10 pounds and I lost 21, I think, last time I had to weigh in. But of course, as you know, if I were to stop the medication, the weight would come back. So it's not, it's not a good option as far as weight loss. So I'm just waiting and concerned that I'm not going, that this isn't going to happen. And I think, you know, when I talked to the nurse, the bariatric team coordinator, I just said something to the effect of, you know, not to worry. I know that this is very common. I know that this happens. I went to the pre-surgery workup on Monday and saw the anesthesiologist, which, what a job. She just came in, said hello, and, you know, have you had any issues with anesthesia before? So most of the work is done by the nurse practitioners. And I mentioned that, gee, you know, no one has seen my belly. And because that was my other concern, that, you know, I'd be on the table and somebody would, you know, the surgeon would say, oh, you know, we can't operate because she has scar tissue. When I turned 50, I went on Optifast, and I was on Optifast for a really long time, maybe like 10 months, just outrageous time, and I lost a lot of weight and had a tummy tuck and had plastics, tummy tuck and a breast reduction, and so I was concerned that it might be something. And so the nurse practitioner said, the anesthesiologist, nurse practitioner said, oh, you know, he's here. So let me just run out and ask him just to make sure. And she did look at my belly and said, no, I don't see any issues, because, you know, they're laparoscopic. And so she was impressed by the fact that you can't see any of the scars. So ladies who are thinking of that surgery, 13 years later, you can't even see the scars. And I had, you know, hip to hip and muscle repair and the whole thing. So anyway, so it's just a, you know, list of going down one fear after the other, which I think it's normal. And you know, my brain tells me, on the one hand, yes, this is all normal, and I think it's part of the eating disorder too. You know, that talk, that and you know, so the talk. The abusive talk, talking, eating disorder, that's, you know, kind of what we talked about it when I was in treatment. They called it eating disorder, saying, you know, good things don't happen to you, so you're not going to get this surgery, who do you think you are, kind of thing. And that, you know, that voice starts to talk to you, that kind of abusive sort of, you know, you're too big for your britches kind of thing. This isn't going to happen, and, you know, this is going to happen. This will happen to everybody else, but not you. So that's kind of where I am. So everyone else, have a great week. Not this Sunday, but next Sunday we spring forward, thank goodness, because then we have a little more daylight, and that just always makes a big difference for me. I've got some stuff coming up that I'll share with you later on in the week. And everyone, have a great rest of the week.